Good morning to all of you, to Gisela, to all of those who make this broadcast possible, and to everyone tuning in each morning. Today, I will not be removing my face mask because given that we are in the phase of limited local transmission, I believe that it is necessary to set an example for the population coherent with what we are requesting, that everyone, despite social distancing, use their face masks as a means of protection and a means of protection against the spread of infection. We've all seen how far micro droplets of saliva can travel and the risk posed by not wearing a face mask. Today, the situation in Cuba is as follows. 959 people are hospitalized, 20 are under observation, there are 443 suspected cases, and 496 confirmed active cases, the highest number we've had over recent weeks. In our primary healthcare system, 11,501 people continue to be monitored by our professionals and specialists. Yesterday, over 4,000 samples were processed. 4,267 were processed in our various molecular biology laboratories. 1,705 were processed at the Pedro Curi Tropical Medicine Institute. 501 in Havana's Hygiene, Epidemiology and Microbiology Center, 474 in Villa Claras, 285 in Santiago de Cubas, 564 in the Genetic Engineering and Biotechnology Center Lab, 439 in the Hermanos Almaheires Hospital Laboratory, and 299 in the Civil Defense Laboratories. Of the 4,267 samples processed, 93 tested positive for SARS-CoV-2 and COVID-19. This brings the total number of samples processed in the entire country since the pandemic began to 301,598, of which 3,046, or 1.01%, have tested positive for the virus. Yesterday, samples were also tested from all of the country's provinces. 944 from Artemisa, 66 from Villa Clara, 64 from Holguín, 88 from Santiago de Cuba, and so on and so forth from all of the country's provinces and the Isle of Youth Special Municipality. Of the 93 positive cases diagnosed yesterday, all are Cuban. 61 or 61.5% of positive cases yesterday are confirmed case contacts. This group continues to run the highest risk of infection both in Cuba and worldwide. This brings the total number of confirmed case contacts to 2,522, or 84.1% of all diagnosed cases. 10 people who tested positive for the virus yesterday contracted it abroad. This brings the total number of imported cases to 310, or 10.3% of all positive cases in Cuba. Meanwhile, the source of infection linked to 22 cases is yet to be determined. We are working hard to locate the source given how important this is toward controlling and containing the virus. It is therefore vital to identify, isolate, and treat the source and anyone else they may have come into contact with. This brings the total number of cases where it has not been possible to determine the source of infection in Cuba to 168, or 5.6% of all confirmed cases. Of the 93 confirmed cases yesterday, 49 people, or 52.6%, are male, representing 50.5% of all diagnosed cases in the country. Meanwhile, 44 are female, for 49.5% of all positive cases in Cuba. There is almost no difference in the rate between both sexes. 62 of the 93 cases, or 66.6%, were asymptomatic at the time of testing. These cases therefore account for 57.4% of all positive cases on the island. I repeat, this is a feature of the virus which makes it extremely dangerous. By age group, 24 people diagnosed yesterday are between 40 and 59 years of age. The most, 43, are between 20 and 39. 16 are over the age of 60 and 10 are under 20. Notice how the 10 cases under the age of 20 and the 43 cases between 20 and 39 years of age mean that 53 out of 93 positive cases yesterday are young people. This is a trend we have been seeing in the country over recent weeks. Therefore, a total of 335 children and young people under 20 have tested positive for the virus in Cuba, of which 294 have responded positively to treatment and been discharged from hospital, representing 87.8% of all cases in this age group. Of the 93 positive cases yesterday, 83 are autochthonous and 10 are imported. 4 from Havana, 2 from Ciego de Ávila, and 2 from Holguín. 1 is from Las Tunas, and another is from the Isle of Youth Special Municipality. I reiterate once again that these imported cases were transferred directly from the airport to isolation centers and have had no contact with the general population, meaning that they do not represent cases of local transmission and therefore do not count toward their province's confirmed case rate. Of the autochthonous cases, 10 are from the province of Artemisa and the municipality of Mariel. Meanwhile, 72 are from Havana and the municipalities of Habana del Este, La Lisa, Marianao, 10 de Octubre, Playa, Plaza, Arroyo Naranjo, Boyeros, Cerro, Centro Habana, Guanabacoa, and San Miguel del Padrón. As you can see, a high number of cases spread over a large area, which proves that important episodes of local transmission are occurring in Havana, because the city itself is like one big municipality, as was highlighted by the president of the Provincial Defense Council yesterday, that unlike other provinces where there is a greater distance between municipalities, in Havana, different areas are separated by no more than a street. This makes controlling the virus that much more difficult, and is why it's necessary to tighten measures in the province, as has been done recently. One autochthonous case was also reported in the province of Las Tunas. Yesterday's results therefore mean that Artemisa continues to be the province with the highest confirmed case rate per 100,000 inhabitants over the last 15 days, standing at 25.83. Next comes Havana with a rate of 12.46, both provinces registering higher rates than yesterday. Villa Clara's rate is similar to yesterday's, at 1.80, while Las Tunas rises to 0.37. With one case reported in Pinar del Rio in the last 15 days, the province's rate remains at 0.17. This means that Cuba registers a rate of 3.10 per 100,000 inhabitants. Of the 3,046 people who have been diagnosed with the virus thus far in Cuba, 496, or 16.3%, are active hospitalized cases. 490, or 98.8%, are clinically stable. No deaths have been reported in Cuba for the last 6 days. Since the pandemic began, the island has registered 88 deaths, for a mortality rate of 2.9%, which, compared with the regional rate of 3.67%, places Cuba in 21st position in the Americas. Meanwhile, the island moves up to 112th position in the world after surpassing Sri Lanka in confirmed cases. As I always mention, 2 patients were previously evacuated at the start of the pandemic. Yesterday, 9 people were discharged from hospital. This means that to date, 2,460 people, or 81% of all confirmed cases in Cuba, have recovered from the virus. Yesterday, 2 patients were reported as critical, one of whom was previously reported as serious. One of the patients is being treated at the Pedro Curi Tropical Medicine Institute and the other in the Salvador Allende Hospital. Meanwhile, there continue to be 4 serious patients. As you can see, the treatment plans and care received by patients means that we have been able to maintain a low number of serious and critical cases, as well as deaths. However, as the number of cases rise, so does the risk of serious complications, bearing in mind the behavior of the virus, which we can clearly see from the rising number of COVID-19 cases and fatalities worldwide. Now we're going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. The total number of cases worldwide currently stands at 19,624,044, after 266,959 people were diagnosed with the virus yesterday. And it looks likely that tomorrow or the day after, we will reach 20 million. Yesterday, 5,779 people died of the virus, for a total of 726,953 COVID-19 fatalities and a mortality rate of 3.7. The region of the Americas, which accounts for 54.01% of all COVID, 615,855 confirmed cases, after 147,732 were reported yesterday. Yesterday, 3,669 deaths occurred in the region, bringing the COVID-19 death toll in the Americas to 389,793 and a mortality rate of 3.67%. This is the information that we have on the behavior of the pandemic in Cuba and the world.